Hello, my name is Alicia Cecil, and I wanted to get on here and make a video for Journal 3. Brief summary of the assignment that I have completed is that I've been doing adolescent therapy. So I have one client that is 16 and one client that is 14 that I see weekly. This assignment relates to my practicum because it's helping me learn how to be a therapist for not only adults but also adolescents. The competencies of this journal that relates to my field practice for competencies 4, 5, 7, and 9. So, in competency number 4, engaging in practice informed research and practice and research informed practice. So, I've been doing different things in therapy, such as narrative therapy and also psychoeducation. Um, and there really hasn't been anything in this assignment that has helped me engage in policy practice, but I have been researching and involved, and I'm following different policies. One of them that I'm interested in is House Bill 556 for the Kentucky Mental Health Access Program for Youth. And this is a policy that will provide more access for adolescents because I understand there's a long waiting list in rural counties and a lack of providers. So I am being more engaged with that. And then for competency 7, assessing individuals, family groups, organizations, and communities. So working with the adolescents also means that I'm working with the family as well, so that we can set goals that are also family oriented, because sometimes the family or the parent or caregiver can provide more information as to why the adolescent is coming to therapy. And for competency number 9, evaluating practice with individuals, families, groups, organizations, and communities. I have been talking to my field supervisor about the therapy and just receiving feedback on anything that she has to add. What I think that my strengths are in my experiences at my agency. So the youth that I'm working with both have substance use diagnosis, and I am very familiar with sobriety and substance use challenges, as I am a person that I am 8 years sober. So I have lived and struggled even as a youth with substance use issues. And I feel that this is a strength because it helps me relate to the clients that I'm working with. My experiences have challenged me and helped me grow as a professional master's level student, social worker in training, because I was not familiar with doing therapy with adolescents. And this has challenged me and helped me just basically step into the role and to learn more about it. Also, to start looking for different trainings to working with youth. The feedback that I've received during supervision basically is to just keep on learning and to be open minded, try to attend trainings that I can locate that are either in person or on video that would help me specialize in different areas of therapy. My thoughts and feelings related to my progress. I feel like I'm doing good. I'm learning more every single day. And even tomorrow, I'm doing my first intake for programming for a client that is mandated here. So I'm very excited about that because I've never done an actual intake before, other than like practicing on staff. The ADI practices that I've observed in my agency. So, like I've said before, and even last semester, this agency is really good about explaining all the paperwork and all the material that is taught in groups to clients in a way that they can understand. They always answer questions. Everything is usually clear and pretty simple to understand. And there's a very diverse population that we work with here. So, what I've done for self care, I've actually started going back to therapy once a week and working on my own things that maybe I see come up in therapy. And the only barrier obstacle for self-care really during this time is just the financial part of it, because I have private insurance, so I have to pay for my therapy. My co-pays are pretty high, but it's manageable right now. I don't anticipate any upcoming barriers. I've also been spending a lot of time outdoors, and we're planning a camping trip, and then also just spending a lot of time after works with my family, cooking and making jewelry, things that I enjoy doing. Um, and then the only way that I can predict that my plan would change as far as self-care goes is like if I needed to cut back on therapy, because right now I'm going once a week and I start that on the 25th. So if I feel like maybe that's too much, I might decrease to bi-weekly appointments or something like that. And how I'm tracking my self-care, I definitely am tracking it on my planner. So I put everything in my planner that I carry with me in my book bag, and that's how I'm tracking it. So thank you so much for watching this video. I hope you have a great day.